The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us for our webinar today on measuring the performance of local early childhood systems. We'll be introducing a new toolkit today that we hope many of you will find useful in your work, and look forward to sharing the work we've been doing and getting a chance to hear your questions and comments on it. So to make the most of the time we have today, just an hour together, I'll get us started right away. Here's who you'll be hearing from today. My name is Kaylin O'Connor. I'm a Senior Associate at the Center for the Study of Social Policy. I'm joined by Steve Cohen, a Senior Fellow at CSSP, and by a number of our partners who have been playing a critical role in the development of this work and testing these tools that we're about to share with you. So I'll introduce them now, and then we'll hand off to them at different points throughout the presentation today. Malia Franklin is with us. She's a consultant for CSSP, and she's been very involved in our parent leadership and engagement work. Petra Pulse is with us from First 5 Ventura County. Aditi Subramaniam is with us from Boston. She's with the Family Nurturing Center and the Family Engagement Network there. And Steve Ames is with us from Central Vermont Building Bright Futures. All of those local partners, as I said, have been critical in the development and testing of the tools that we're going to be sharing today. So we wanted to start by just grounding ourselves in the driving questions that brought us to do this work and that we hope brought you to be interested in it to sign up for the webinar. And those are two core questions. One is, what is the value of having an early childhood system? And the other is more specific on that, which is what can you achieve with a well-functioning early childhood system that you couldn't achieve just with high-quality programs and services? So we really want to dig in on those questions today. We've been digging in on them in this work for about 3 years together, and we're excited to share where we've landed on that and hope that some of the thinking and tool development that we've done to try to help answer those questions will be useful to you. So we'll start out with a little bit about who we are that's talking to you. Some of you know us well, some of you may not have heard of us before, so we just want to share that. And we'll talk about where our interest in common metrics comes from and the work that we've done first around outcomes and indicators. We'll touch on that really briefly, and then we'll get into the meat of what we're going to talk about today, which is the system performance measures and the new tools that are available for you to use. And we'll be hearing along the way about community pilot experiences with some of the tools. We're not going to be able to get into all of the tools that are part of this toolkit, but hopefully give you enough of a sneak peek that you'll want to check it out and learn more. So I'll say just a little bit about CSSP. We're a national nonprofit with our main office in Washington, D.C. And we just celebrated our 40th anniversary last year. You see the theory of change there that I'm not going to go through in detail, but we just wanted to show that so that you can see that this work on wondering about and trying to measure the value of early childhood systems is really core to all of our work. We work in community change, systems change, and policy change, all towards our goal of achieving a racially, economically, and socially just society. And so you will see throughout that we are very focused on issues of racial equity and social justice, and also on caring about the results of our work and paying attention to it so that we can make the best decisions possible to benefit children and families in our work. And then I wanted to tell you about EC-LINC, or the Early Childhood Learning and Innovation Network for Communities. This is an initiative of CSSP. We convene EC-LINC as a network, which is a group of 14 cities and counties from all across the country that come together to focus on local early childhood system building, specifically with a focus on improving results for young children. We define that as prenatal to age 8. To jointly tackle the toughest challenges that are faced by children and families in their communities. So working together on how we can solve some of the problems that occur across many communities and applying each other's learning to see how we can use it in our own communities. And then accelerating the impact of these community-based integrated early childhood systems, which we define as, at a minimum, bringing together health, early care and education, and family support. And in most communities, there are also other partners at the table of those systems and community structures that touch the lives of children and families. So with all EC-LINC projects, the members have opportunities to participate in various levels or to various degrees in the work. And we've been very lucky to have 7 of our participating members very engaged in this work on outcomes and metrics for early childhood systems over the last 3 years. So you'll hear from some of them today, but I want to make sure we give credit to all 7. Ventura County, California, that's the first 5 in Ventura County is the lead agency. The Children's Services Council of Palm Beach County, Florida, the United Way in Boston, the Children and Families Commission of Orange County, California, the first 5 of Alameda County, California, Lamoille Valley in Vermont, led by Building Bright Futures and the Lamoille Family Center, and then first 5 LA in Los Angeles County. We also had tremendous support to make this whole project work from Parsons Consulting, and Kari Parsons, Kirsten Smith, and Kendra Lodwick were huge driving forces in getting this work done as the communities and us from CSSP all came together and shared our thinking. The community's experience on the ground with what data was reliable and useful and what they would be able to measure was tremendously informative, and then the work of Parsons Consulting was bringing that all together and shaping the work and keeping us all pointing in the same direction to come up with this toolkit that we're going to share today. So when we come to why we're all working on this, I think we have an interest, and many of us do around the country, in common metrics for what this work is that we're doing, especially when we get for early childhood work in general. How do we measure our success? And then particularly when we're taking a step back from direct service provision with system building, how do we evaluate our progress? How do we know that we're doing our work well? And so we had 3 drivers for why we have this interest in common metrics. One is just to evaluate progress, to say we have advanced these child well-being outcomes in these ways through our work, and through the work of our partners. Another is as a basis for quality improvement efforts, so to be able to say we're not moving the needle in a particular area, what could we be doing better? Or we're doing really well in this way, and how can we spread that to other sectors of the early childhood system? And other ways that we can use data for quality improvement when we have it and we know we can trust that data. And finally, we want to be able to tell the story of local early childhood systems and build support for it, because sometimes it's a difficult case to make for funding the system building side of the work, which is a lot of meetings and a lot of conversations, which don't always look as impressive to a funder, for example, as direct service provision might look, but which is really critical to improving the quality and knowing that you're doing it well at a community or higher level. So those are our 3 reasons for diving into this work. And what we've done in this area, and I want to make sure that I'm not stepping on Steve's toes, I'm going to keep talking here. The kinds of metrics that we've been looking at are the, excuse me, first of all, measures of how children and families are doing. So there we're talking about what we usually think of when we talk about measures, looking at outcomes, so conditions of well-being for a whole population of children and families, and then indicators, which are the measures that help quantify whether we're achieving those outcomes. And that's a question that a lot of people in our field are asking right now, as they should be. It's a really important question to say, how do we know whether we're having an effect? What are the outcomes we're working toward? Sometimes we can be doing a lot of good work, but if we're not clearly articulating what our outcomes are, it's not clear why we're doing that work. And we might be doing some work in areas that aren't going to affect the outcomes we've said we care about, which either means we need to redefine what we say we care about, or that we need to redirect our work towards really affecting the outcomes that we're concerned about. So we'll share a little bit about what we did on that, which was the first year of this work. And then we got into a question that was of a lot of interest and really a natural fit for our EC-LINC network, as I described it, which was measures of how early childhood systems are performing. So not just what are these population level outcomes that we can see we're either having an effect on or not, but what are we doing that's either going to help us get closer to those outcomes or might not. So that's where we came up with what we call value propositions, 4 big statements about the contributions that we think early childhood systems make toward improving those outcomes for young children and their families, and then coming up with metrics that would help to quantify whether we're achieving those contributions we're trying to make. This all borrows heavily from results-based accountability and from the concept of asking what are we doing, how well are we doing it, and is anyone better off? But really taking that from a system level and saying, what are we doing? What's our contribution towards the outcomes we're trying to affect? And how well are we doing playing our role in this entire process? So I'm going to hand off to my colleague Steve Cohen, who's going to explain the outcomes and indicators that we landed on. Yes. So I'm going to hand off to Steve for that.
Thanks, Kaylin, and good morning, everybody. Good afternoon to those of you who are not still on the West Coast. This one slide is going to tell us a little bit about the outcomes and indicators work that, as Kaylin said, represented the first year of effort by our team. We had 3 outcomes. They were generally in the area of health, that pregnant women and young children are healthy, learning, that children are on a path to succeed in school, and the context in which children grow up, that they live in safe, stable, and nurturing families and communities. And you'll see here that we identified 3 or 4 measures, indicators, under each one of these outcomes. I won't go through them individually. You'll immediately see that for any of these outcomes, there were probably dozens of potential measures that we could have chosen. We picked ones that we thought were really important, captured a lot of information, reflected the social determinants of health to some considerable degree. And as you'll see, despite all of that, this is quite an imperfect list of measures. For example, under environment, what we really want to know about is children growing up in nurturing families. What we can measure is maltreatment, which is obviously a very small piece of that, a very important piece, but a very small piece. And the group has begun to think together about how we might get to more refined and nuanced measures that really get at some of the things we care about the most. But I'm going to call a stop there because this webinar isn't about the outcomes and indicators work. I presented that only to give you a little bit of background on what led us to the next part. And so let's move on. And as Kaylin said, the focus of our webinar today is about system performance. And you see here some pieces of the toolkit that introduce the notion of system performance. I'm going to take us directly to the next slide now so that we can begin to talk about the 4 value propositions that Kaylin was talking about earlier. So a key part of our work was identifying the ways in which an early childhood system contributes to improved outcomes. This slide is an overview of those 4 contribution areas. And when I finish with it, we'll start to walk through each of the areas as a whole. And for each of them, we'll present all the measures to you, but then go into detail about one of them as an example so you can get a better sense of how the toolkit works. So the first value contribution is about reach. We came to think that one of the values that an early childhood system creates is that we ought to be able to better reach all of the young children and families who need services and supports in the community. The second one's about coordination, that if we're working together in a system, we ought to be able to be better coordinated, and that means, for example, things like helping families get to the right place, helping families that are involved with multiple service systems get coordinated services rather than services that are fragmented and disconnected from one another. The third value proposition is commitment, and that's a way of capturing the way in which an early childhood system can help educate a community about children's needs, engage community leaders in acting on behalf of those needs, and pursue a policy agenda to make things better for children and families. And the fourth contribution is equity. It actually covers a couple of related topics. The first one is around parents having a substantial and important role in helping to build and guide a system. And the second, as Kaylin was saying earlier in the conversation, is about trying to achieve a system that can reach equitable results for all of the children and families in the community. Let's move to the next slide. This one's hard to read. You'll obviously see it better in the toolkit itself. It's up as a way of, thank you, Kaylin. It's up as a way of just showing you how each section of the toolkit begins. You'll see in each part of it a table that lays out in a kind of summary form each of the measures under this commitment. and some background information that includes the resources that are needed to measure, the types of stakeholders who need to be engaged, the data collection requirements, and the level of effort that will be needed to use the measure. Now let's go to the next slide for the measures themselves. I'm going to walk you through the first value proposition, which is the one about reach. And you'll see here a set of measures that generally speak to whether services are reaching the families and children who need them. So we begin with early prenatal care, that is that mothers-to-be get help before a child is born, promoting the baby's health and their own well-being. That then move on to services shortly after birth, including, here on this slide, screening for maternal depression, and the connection to services of parents who are identified as potentially having depression and therefore being in need of help. Just a note about this one, we didn't particularly want to single out depression only. Obviously, there are many other mental health services and needs that are quite important. Depression is the one that's most prevalent and most often screened for, and we thought it was a useful starting point to get at the look of the mental health needs of parents of young children. Let's move to the next slide, and I'll continue this list of the individual measures under value proposition 1. The third measure is similarly around screening and services for young children's development. So we ask questions like, what percentage of young children have received a standardized developmental screening? And then of those children, were they in fact connected to services if they need them? I'm going to skip over the item in blue for a moment because it's the one we're going to present in some detail in a moment, and just briefly give you a glimpse of the last couple. The last two here are around services, the availability of services in the community that are needed by many, though not all, young children and families. So 1.4 is an effort to get at the question of whether there's an adequate supply of high-quality early childhood education programming. And 1.5 is an effort to get at the question of whether there's an adequate supply of home visiting for families who need that kind of support. Now let's go to the next slide, and we're going to talk in some more detail about 1.3.3. There's a mouthful for you. Early identification. There's lots of conversation about screening in the world of early childhood services. You've already heard me talk about the way in which we want screening to be connected to services so that it's not just that a family's been screened, but that if a need has been found, it's actually being addressed through services. With this measure, we took a big step back from those kinds of process conversations and asked ourselves the question, how could we know whether all that screening and referral is actually making a difference in our community? Thinking about all the young children in the community, part of the answer to that question should be, if we've got a well-functioning system, we'll do a better job of finding problems early and getting those problems resolved, or at least beginning to address them before they become more severe. This measure is an effort to construct a way to test how well we're doing that. And the basic idea is that for some, though not all developmental needs, it ought to be possible to identify them early, and it's better when we do. So this measure, as a measure, right, the denominator is the number of children with certain special education needs identified by the end of kindergarten, and the numerator is the number of those children who received early intervention for those needs prior to kindergarten. So again, the idea here is more early identification better, more kids not having their needs discovered until they get to the primary education system, not as good. The certain special ed needs are speech and language help and services related to autism, and that took a fair amount of work for us to get to as a group, and that came from the realization that those are the two clusters of services that can usually be identified early, as opposed to some other special ed needs that genuinely might not emerge until a child's in kindergarten. So we thought those were the most sensitive ones to look at to test this idea that a better functioning system will find the needs earlier rather than later. This measure is a little complicated. It's a little messy for reasons that are laid out in the toolkit. For example, children may move in or out of the jurisdiction in a given period of time, and so they might pop up in one place but not in the other. Some children might have services that are so successful in early childhood that by the time they get to kindergarten, they no longer require special ed at all, and so they won't be identified as a success in this measure. It's not perfect, but we thought that having it, and especially tracking it over time, so that we see whether a community is doing a better and better job of finding the young children who need help early, will be a valuable proposition. We've taken the big, difficult concept, early identification, and turned it into something we can measure. And there's lots of detail in the toolkit for people who are interested in exploring this measure further. So with that example of one of the measures under reach, I'm going to stop with this first value proposition and turn back to Kaylin for the second contribution area, which is coordination. And as you'll see, whereas under reach, we were still largely looking at administrative data, here, beginning with the second value proposition, you're going to see that we needed to create some new mechanisms for data collection in order to be able to measure these ideas. Kaylin, back to you.
Thank you so much, Steve. So as Steve just said, when we got into these other value propositions, it became very clear that there was not administrative data that was going to capture what we were trying to talk about. And in our scans of what was available, we weren't finding other tools that were already designed to measure what we were trying to get at either. So we developed a lot of tools and piloted them to varying degrees of rigor in communities. And what we're presenting here are not validated, reliable tools. They are ideas that we think will be helpful and that we'd love to have you start grappling with and see if they're useful to you. And some of these could eventually get to that level of being used more, being tested more. But at this point, they are offered as ways to start thinking about these issues in your system and hopefully things you can use. So when we get to system performance measures under coordination, we have 5. It's less complicated than the first one was. So the first is family assessment, and that is whether service providers are understanding and assessing the full range of family strengths and needs. So that's if a family walks in the door looking for a service for their 2-year-old, but you realize that their 5-year-old also needs some different support, or that there's some other issues going on within the family that are outside the realm of your early childhood program, how likely is it that you're assessing that, acknowledging that, but also that you're making connections to other services, which you'll see in the 2 subsequent measures. The other piece under family assessment is that focus on not just needs but strengths. So assessing the whole family and having a focus on strengths. Many of you know CSSP through our Strengthening Families work. We are big on family strengths and taking a strengths-based approach to work. And we think it is important and a contribution the system can make to ensure that providers throughout the system are focusing more on strengths and focusing on what the full family needs, because that's what it's going to take for the children to thrive. So the first one is family assessment. The second is system navigation, and I'm going to share a little bit more about that in a moment, along with the third one, which is working together. These are both about how well service providers are working together. So I'm going to dig into those in a moment, but first I'll check on the other 2. 2.4 is about using data. So this is about how much system stakeholders, including the service providers and the system level coordinators and other partners, are using data. That's to use it both for service coordination at the case level, but also to support planning and quality improvement at the system level. And those are 2 different types of functions of data that a system might be doing one really well and not doing the other. But usually when you've got a shared data system and are moving forward with better data sharing agreements, you can do both of these you can use that for both of these functions. And the last one is capacity building, which looks at how the system supports professional development and organizational capacity building for the programs and agencies and organizations that make up the early childhood system. So let's zoom in on this 2.2 and 2.3, which have been used together in the places that they've been piloted so far. And I hope this is large enough that you can make it out, but I'll read a little bit to give you a sense of what these are about. Both 2.2 and 2.3 start out with questions that are designed for service providers to answer about their own experiences. So in each case, it starts out with a scenario. In system navigation, the scenario is a family has come to your organization for help. You've assessed their needs and found that some of their needs cannot be met by your organization. Or, for example, a family you've been serving now needs a more or less intensive level of service, or a family has a child aging out of your service and needs support from another organization. And then the questions are to rate how likely it is that you'll know other organizations in the community to refer them to. You'll be able to you will help the family decide where to get the help they need. You'll give the family the name of a specific person to contact where they need it. You'll contact the organization, let them know you're making the referral. You'll conduct a warm handoff, and then if there's a problem with the referral, you'll know who to contact to try to solve the problem. So those are sort of gradations of how well connected the service provider is to other service providers and how much they work with the family and with the other provider to make sure that the family gets the service they need. And then the next scenario is that you're providing services to a family that's also receiving services from one or more other organizations. And for the situations where coordination with the other service provider would be useful, how likely is it that these things would be going on? You would know the family's receiving multiple services. You'll know the nature of the other provider's work with the family, and they'll know about yours. When you develop or review and revise a service plan, you'll have up-to-date information from the other provider. You'll contact the organization. Oops, it looks like that's a repeat. We've still got some formatting details we're ironing out with these tools. One question is repeated there. The plans will be coordinated across the two services. You'll have informal contacts with the other provider, and you believe that the other provider will work with the family in a way that makes your work more effective. So the service provider's perspective, again, on how likely these things are to happen, that would really indicate that services are working well together. And then we go through, and this has been handled a little bit differently in the different places it's been piloted, which you'll hear about in a moment. But we say, in one way of doing this, in answering these questions, you've been thinking about your experience with many different sectors. Now please think about sectors individually and give your ratings as follows. So we list the different sectors that they may be making these types of referrals or coordinating services with, and then rate how each of those services does. In some of the ways it's been piloted, those original questions that you saw here were actually asked about each other sector. So that's a bit more repetitive, but you get more specific information. This way the service provider answers the questions generally and then says, you know, usually it goes well with this sector, but it doesn't usually go so well with this sector. So now we're going to hear from two different places, very different contexts, who have tested out these tools, and they're going to each share what they did and a little bit about what they learned from it. So when I say they're very different, one is a region in Vermont, pretty rural, pretty well connected with all the providers for the most part knowing each other. And Steve Ames is going to talk about his experience there. And then we're going to hear from Petra Pulse in Ventura County, which is a county just outside of Los Angeles County, much more populous, much bigger with the number of people and providers there. And therefore, while you have a lot of strengths with having more providers and more services available, you might not have as many connections because there's just so many people to keep track of as a service provider to know all the other providers. So you're going to hear those two perspectives. First, I'm going to hand off to Steve Ames to talk about the experience in Vermont.
Thank you, Kaylin. So we developed this tool mostly from preliminary work that Steve Cohen did and turned it into a Google form. And what we wanted to try to do is measure, sort of as Steve mentioned earlier, how coordinated and connected the different groups that work to support families are. And I'll just jump into our most granular pilot, which was with 15 home visitors in 2 organizations, an early Head Start and our Children's Integrated Services organizations in our county. So what we did was we customized this survey, and you can see a piece of it on this slide, and we sent it out to all the home visitors in the program, and they all answered it anonymously. And then we collected the data and had a meeting with those home visitors, who then discussed the tool and discussed their results. And the survey could easily be used every year to measure whether there was an increase or decrease in coordination and integration. So it also can be customized So it can be customized to address different populations. And when we used it with our home visitors, it measured what they thought their connections were, like with medical homes, with the schools, with child care providers, and so forth. So it really is a subjective measure, but it was easy to use the survey, and then the discussion afterwards had a lot of value for the people taking it, because just taking the survey provided an educational and sort of supportive reminder about the importance of coordinating care. So if you want to go to the next slide, Kaylin, it's just sort of a picture of how the results come out of this Google form. So it was really easy to look at and understand, and it generated a lot of discussion, and it reminded home visitors what relationships they might want to strengthen, who they could call to find out about important connections. So people are really excited about it, and the pilot led to a number of different sized organizations, including state agencies in Vermont, wanting to adopt this survey for their purposes. So we found it to be easy to use, easy to customize to our particular community, and it's easily shareable. So our work to turn the tool into a Google form that's easily deployable and customizable is shareable with all of you. And I think Kaylin and Steve will discuss how that might be possible. And we intend to roll it out again soon. So it was pretty exciting. So now I'm going to pass on the mic to Petra Pools, who's the Executive Director of First 5 Ventura County.
Yes, thank you, Steve, and Kaylin, thank you. Good morning. In Ventura County, we were also part of this larger effort for going on 3 years, and I wanted to put the pilot that we did in context first, and with a little bit of background information. In Ventura County, we've had what's called a citizen review panel for child welfare services for a number of years, and that group was really charged with examining how well our child welfare system and services are addressing community needs. And through that process, we did a very deep dive into our child welfare data. And what we found is that there are 5 zip codes in a very densely populated area of our county called the Oxnard Plains. And what we found is that 50% of our child welfare removals came from those 5 zip codes. Even more disturbing was that more than half, about 60% of all those cases were infants and toddlers. Now, to put it in context, though, 50% of the child welfare removals from those 5 zip codes, but those 5 zip codes only represented 26% of the overall population and 34% of the child population. So we found that there is a huge disproportionate share of child welfare involvement in a relatively small geographic area. Because this area typically is considered very high need, high poverty, we find that more than half of our county and community support services are also located in this particular area. So we saw tremendous need in a very small geographic area, but we also knew that a lot of resources and supports are available to families. So we were kind of scratching our heads and really wanted to understand what was going on in those zip codes. Next slide. Kaylin, next slide. Thank you. So this really was a great opportunity for us to utilize some of the tools to pilot the system performance measures 2.2 and 2.3, where we wanted to understand the experiences of parents in regards to the multitude of services that are available to them in Oxnard. And so we started to do some data collection on parents as well as on providers. And we did a couple of different things. We held parent cafes where we reached about 103 families that represented Head Start, state preschool families, but also from high-need immigrant Mixteco populations, a very broad representation, as well as families who are involved in the child welfare system and foster parents. And majority, 80% of them cared for a child 5 years or younger, and we had several of those parent cafes conducted in Spanish as well. So we had a pretty good turnout, good experiences with that. But we also wanted to hear from parent advocates and kind of peer parents. And so we did several focus groups with them. And again, an entire group was conducted in Spanish. Next slide, Kaylin. And so what we did is we spent about a month collecting that data in the parent cafe as well as the focus groups. And we had great turnout. We provided gift card incentives. We did some raffles with parents. We made sure that there were snacks and dinner available for them. And we really enlisted our steering committee that is involved in this child welfare redesign plan to help with recruiting parents, but also some of the peer parents. And so what you have here are some of the sample questions that we ask, really trying to understand what the family's experiences are in terms of finding services, connecting with services, and then once they've made that connection, what their experiences was with actually accessing the services. Go ahead and next slide. And so it was a really interesting process. We broke down our results into a couple of subcategories, and so we wanted to share here with you what some of our findings were that parents told us about how they go about finding services. When we looked at parents who currently were not connected to an agency, they talked about family and friends being a very trusted resource for accessing services. And they also talked a lot about just going to community resources and events to kind of find out about services. What we learned from parents that were already connected to an agency is that a family resource center type format where they can go and access multiple services in one location was really beneficial to them. And within that particular format, they really preferred having one point person within an agency to really help them navigate that system. When we talked to new parents, we were very curious. It was very curious to hear that medical providers who we've consistently viewed as trusted messengers and referral sources, the parents really had mixed results with their pediatricians. Next slide. When it came to asking parents about their experiences with the services themselves, we heard that families get involved in services and then their situation improves and they no longer qualify for services, but the family may not be fully ready to disengage. So there was some learnings there in terms of continuing to support families for longer times, and they may qualify for. We also heard about how services are very fragmented and that it's very difficult for families to access services, especially if they are located throughout the county, not under one roof. And then finally, we heard that, no surprise here, that many services are only available between 8 and 4, and that for a working parent or for a parent with a child in school, preschool, elementary school, it's very difficult to access those services. And then we also heard that a family that is really interested in accessing multiple services, that they oftentimes have to complete very redundant intake forms, and they have to kind of tell their story over and over and over again. And families said they don't always know what the providers are looking for, and so they felt like there was this secret code word that they need to mention in order to qualify and receive services. And that sometimes that secret code word works for one family but not for another, and it changes. Next slide. And then with our monolingual parents, we heard very loud and clear that they often feel looked down on by service providers, and that they are just very uncomfortable accessing those kinds of services. And a lot of times materials, intake forms, other types of information may not be as readily available in their preferred language as we had hoped to think. So that is a very high-level overview of our findings from piloting the System Performance Measures 2.2 and 2.3. And it was really a great experience and perfect timing as we are beginning to convene service providers in that particular geographic area of our county to develop what we call the Ventura County Prevention Plan. And that plan is really viewed as a framework for the different service providers and service sectors to come together to kind of really and really look at how do we bring our resources to the table in a different way based on those parents' experiences in accessing and finding services, so that we can do a better job and ultimately move the needle on child welfare entries. So that's what we've been doing in Ventura.
All right, thank you so much, Petra. That was really helpful to see, and I hope people found it useful to see how you took those questions and translated them into questions for parents as well as for service providers. And combined with what Steve shared from Vermont, hopefully that gives people a good picture of how these tools can be used. All right, I'm going to keep us moving and hand off to Steve Cohen to share a little bit about the system performance measures under commitment.
Thanks, Kaylin. This one will be brief. You see on this slide the three measures that we came up with under this header. One that looks at understanding, so wanting to know how the system has acted to help families in the community, leaders in the community, understand what young children and their families need in order to be successful, and the role that they can play in supporting young children and their families. A second one about the engagement of leaders, and I'll come back and talk about that one in a little bit more detail in a moment. And then a third about whether the various elements of the system are working together on a common policy agenda to try to improve conditions for young children and their families. So let's go to the next slide. And I will ask, somebody might need to mute in the background there. Thank you. So this one's about the 3.2, the leadership engagement tool. We structured this tool around a sector-by-sector review of how engaged leaders are in supporting early childhood and what actions they're taking as a result. So you can see some examples of those sectors: the business community, healthcare leaders, faith communities, service organizations. There are others you'll see on the tool as well. We then identified 7 dimensions of leadership engagement. So examples of those, you see them in front of you here, are things like taking part in the work of the early childhood system, devoting resources to early childhood, participating in coordinated policy advocacy. Okay? So the tool then calls for early childhood leaders to do an assessment, and it's a self-assessment, along each of these dimensions for each sector, using the same kind of rating scale you saw earlier, from 1, which basically is little or none of this is going on, to 4, which is where pretty much the optimum level that we're aiming for, consistently doing what we hope for. The ratings, again echoing a theme you heard from Steve and Petra earlier, are not meant as the be-all and end-all. The ratings are really meant as a way to create and structure a conversation, right? So if you do this self-assessment, you can then get together with your key stakeholders and ask the question, how well are we doing along each one of these dimensions? And there's a set of discussion questions in the tool, things like, What do we most need from leaders in the business community versus the faith community versus the nonprofit world? Who are the current champions within that sector, and what are they contributing? Are there other key players who need to be brought along? Is this work more about getting those already deeply involved to do even more, or is it about deepening the bench and getting others from these sectors to be more involved? After all of that, the community can assign itself an overall rating on this measure, but more importantly, we think the conversation creates the basis for an action plan. What are we going to do next to engage community leaders more deeply? To what end, right? And that's an example of the way in which we're trying to use many of these measures to structure conversations that can lead not just to an evaluation conclusion, but to an action plan for what you can do moving forward. So with that, let me turn it back to Kaylin one last time to take you through the fourth value proposition, which is about equity.
All right. Thank you, Steve. So in the area of equity, we're as Steve said, we're looking at two big pieces of that, parent engagement and advancing equity, but we see them as very intertwined, so we put them under that label together. We're going to talk in detail about each of these, actually. We're going to hear from two people who helped to design and are now piloting the parent engagement and leadership tool. So we developed this in parallel in parallel to the work that was going on the rest of the toolkit, with Malia Franklin leading the work. It aligns very closely with CSSP's Ripples of Transformation toolkit, which many of you have seen. If you haven't, you can look it up on our website. And more recently with our manifesto on race equity and parent leadership in early childhood systems. And so it all lines up with that and has been piloted in several communities, but most intensively in Boston. So we're going to hear from Malia and from Aditi Subramaniam, who's been leading that pilot in Boston. And I will just point out that there are three versions of the tool. One is an abridged version. One is a comprehensive tool that's really for doing a large organizational assessment. And then one is questions for grant makers, policy advocates, and capacity builders about how they are using these principles of parent engagement and leadership, and also how they're encouraging the others in their sphere of influence to do that. I am going to just quickly say how the tool is structured, and then I'll hand off to Aditi to talk about the pilot in Boston. We have 4 pillars of parent engagement and leadership. So those are that the work is family-centered, is equity-driven, it's collaborative, and it's transparent. Within each of those pillars, there's a section of the tool for each of those pillars, and within each of them, the questions fall along 4 dimensions about commitment, capacity, practice, and influence. So I'm going to say that much and let Aditi take it from here to talk about her piloting of it, and then I'm going to unmute Malia so she can jump in on the next part of this conversation.
Thanks, Kaylin. This is Aditi. So EC-LINC for us in Boston, as you can see, is a combination of 3 system organizations that are there. I work at the Family Nurturing Center, which is a community center. United Way is the primary partner, and the Boston Opportunity Agenda. So it's the 3 of these organizations that are involved in EC-LINC. At the Family Nurturing Center, my role is the coordinator of the Boston Family Engagement Network, which is a citywide coalition. It's a citywide coalition of providers and parents and early childhood stakeholders coming together to support family engagement at the core for birth to 8 around the city of Boston towards school readiness and all-round development. Kaylin, we can move the next slide. So the pilot in Boston, we've been involved in the learning community with EC-LINC, with the family engagement tool for the past 2 years, and the pilot in Boston, we engaged, Boston Family Engagement Network includes 9 agencies across the city in every neighborhood in Boston, and we engaged each of the neighborhoods to be a part of the pilot, and the way it worked is we had them choose one of the pillars based on what Kaylin just presented to all of you, looking at whether an agency is equity-driven or family-centered, had them choose one pillar and then organize an assessment team. So really, this is a 360-degree assessment and an evaluation that is, there's no pass or fail, and it just really looks at not just having providers sit and do the self-assessment, but really have families and at the center of it giving their voice. And once the teams created their assessment team, We had family engagement coordinators, the parent leaders, and a community member evaluate that pillar and actually rate where they see this particular pillar in their system, in their organization. They all met to make sure that everybody understood the instructions. And then, the goal was to decide, are they actually looking at one program in their agency, or are they looking at an entire agency? For the purpose of this pilot, we actually focused on one program. And then each team member completed their own copy and then sent it to us. And then I sent it to Malia, who will talk pretty soon. The vision was to have all 9 agencies do the pilot. However, the reality was that 3 agencies were involved in the pilot. And Kaylin, we can move to the next slide. And some of the examples that we got from the parents and from providers together about the pilot of the assessment was that, the intent, I think the intention was really understood, that it was not to get a good score. And there are some examples you can see here that it was to place an agency within a continuum of family engagement best practices. And thinking about it from a strategic planning perspective, there were questions of that there'll obviously budget constraints and funded deliverables, and how, if parents know what these are, they can participate in decision making, which actually aligns with the transparency pillar, like how transparent is an agency. And then there were some other examples about how does it mean, how can family engagement actually support budgeting and fundraising. So the pilot that we did actually, I think, was also helpful in thinking about, could we have different, could there be different versions of the tool, like an abridged version, a comprehension version, and funders version. And then just quickly, my last slide is, this was last year, and where we are right now is we got some funding from another organization, and we are actually implementing the self-assessment tool actually in the evaluation for this project, which is really looking at building citywide, equitable citywide parent leadership. And we're actually in the demonstration phase of through 2019 to 2021. We're integrating the self-assessment tool on year 1 as we speak, and then in year 3 to really look at is it actually shifting agency practices across the tool, looking at equity and race at the center with parent leaders. And for that, we're actually going to be doing a follow-up webinar on how to do it. We had a first learning community, and we're able to engage Malia, inviting her to be a part of that training for the providers and parent leaders in the room, so that everybody is having a shared understanding of the process. So we'll have more to share pretty soon.
Wonderful, thank you. I'm going to have Malia jump in now if she can. Malia, are you there?
Yes, I am. Good afternoon,
Wonderful.
everybody. I am calling in from Oakland, California, and it's been a privilege to work with many folks in EC-LINC, and especially Aditi and the parent leaders in Boston on this process. And so there's just a couple of points. Aditi did a really good job of explaining the implementation, at least one option for implementation, which we recommend. But I wanted to just underscore a few points. One is, I think it's good to look at this tool as more, it's a conversation starter. It's also a planning tool, an action tool, an action planning tool, and really it lets you know where you are. So it identifies at a point in time, here you are, and here's how different stakeholders that you interact with. We talk about a 360 where you have staff at the leadership level, staff at the frontline level, parent leaders, and even perhaps outside collaborators, all assessing the agency on the various pillars, but really to establish both the differences and similarities of opinions about where you are, but in particular to establish where do you want to go from here. So as Aditi said, it's not about getting a good score. It's about identifying what are areas that need attention, what are areas you're already strong on. And then also, I think a second point is who needs to be part of the journey of where we go from here. And oftentimes, parents aren't already part of the journey. And so it's an opportunity to get organized around including parents in a more thorough planning and an evaluation session. So we can go to the next slide. And the other thing is, as Kaylin and I were talking about this after the fact, this tool looks very different from the other tools. And part of it is that it just really is, it's such a complex issue, family engagement. It's the way we've defined it is very expansive, and therefore there are many both subtle and huge changes that need to take place. As a result, it can seem pretty overwhelming, and a lot of agencies can react by saying, oh, that's just, you know, we're so not there. So we really, I think, want to emphasize this. It's a self-assessment, but it's really a quality improvement tool. That's kind of the direction it takes you in. So the assessment is one step towards improving quality of your family engagement, scope, scale, and quality. And then with the information that you gather to plan what you're going to focus on, perhaps in small pilots to see how things work, and then to see what the improvement, you know, to improve, target areas for improvement, and then to assess again. So really, it's to start a conversation about a much larger change strategy. I think the other piece that I've been learning and think is really important to point out is that I think agencies can learn a lot from just engaging in a process with this assessment, especially if they're engaging with parents. Even if they have been engaging with parents over time, they may find as they look at some of the areas, the pillars, that they can see that the assumptions that they had around engaging parents maybe are not quite expansive enough. And so, or that it seems really, really challenging to gather a group of parents to participate in the self-assessment process. How can this be a first step in engaging parents, and how can you learn from the experience if that's something that has been difficult for your agency to do? I think the other just really important message is that, as I said before, a big reaction is overwhelm. We don't have the funding, there's too many obstacles, et cetera, et cetera. I think the message is you don't have to know everything or to have everything in place in order to start making changes. There is a lot that can be gained in piloting small changes and learning from them. This is an iterative process. It's a very long process to go from engaging parents in a very superficial level to deeply engaging parents as partners and leaders. And there are many cultural and policy shifts that have to happen within systems and agencies in order to make that possible. And there's, you know, a lot of big questions to grapple with around sharing power with parents. So I hope that people pick a way to use this tool in their work. And again, we created many tools, many sub-tools or options. And we also want, I know Kaylin's going to push this too, but slides in front of me on April 11th from 3 to 4 Eastern Time. The monthly Strengthening Families webinar will focus on this leadership assessment in a great deal more detail. So I hope that you join for that as well. And that's what I have. Thank you so much.
All right, thank you, Malia. I put that slide up because I know we are hitting the end of our hour, and I wanted to make sure people saw that, and in case people had to jump right off for another appointment. But Yes, we're very excited about the parent tool. As you can imagine, there's a lot more to share about it. And so we're doing a separate webinar about that, and we will put that information in the follow-up email that you'll get from this webinar. We're going to power through to keep talking about our last system performance measure. I apologize to anyone who needs to get off, but this is being recorded, and you will receive a link to the recording in your follow-up email. So if you need to jump off, you can do that, and then fast forward through the recording to get to these last few minutes, because this is really good stuff too. So finally, we want to make sure that we pay attention to the question of equity, and that was part of our conversation all along. And the original conversation about outcomes and indicators that we referred to earlier, we were talking a lot about disaggregating that data to find differences by group. So for whatever indicator we're talking about, who's thriving in our community according to these indicators and who's not? Which population groups are carrying an excess burden around some of these indicators? And then in some cases where we might not see improvement on an indicator overall, we still might be seeing changes in the disparity rate, which is an overall positive change and an important change even if the overall indicator isn't moving as much as we'd like. But then we got into the system performance measures and realized, first of all, because we're not looking at administrative data, we can't disaggregate that data to look at any differences for population groups in some of these measures, but also that there are things we could say an early childhood system should be doing to advance equity beyond just looking at the data. So we developed a tool about what the early childhood system is doing to advance equity, and you can see here we broke it down into 10 topic areas with some specific questions about what that would look like. And this is, again, a self-assessment tool for early childhood system stakeholders to use to then point themselves in the direction of some things they might want to start doing differently. So those topic areas are data, policy analysis, access and high quality, so making sure that people have access to the services that are high quality, investment, so how the system is using its resources, professional development, leadership of the early childhood system itself, partnerships, communication, incentives, and having an equity agenda. So all of those areas are places where we have seen early childhood systems doing really good work and where we think more should be doing that work. And so it's a way to assess what you're doing and, as with all of these tools, identify some areas for improvement. I'm going to speak briefly about how we can use these tools. The toolkit and each of the individual tools will be soon located at the website address that you see there. We're still putting final design touches on it, as you may have been able to tell from some of the images we shared today. So those will be posted soon, and we will email you all when they're available so that you'll know it's time to go and dive in and dig into all of these. So what we would recommend is you scroll through them and then pick a couple of system performance measures that are of interest to you or your community. Use the tools. You are free to modify them if you need to, if it doesn't seem like it's asking the exact right questions, or if there's things that you want to connect it with that you're already collecting data on, for example, go ahead and do that and develop an action plan based on your findings. And from our perspective, we would love for you to give us feedback once you've used the tool, because these tools, as I said, are not set in stone. We don't have a current timeline of when we're going to go back and revisit any of them, but we do hope to be able to do that in the future. And so knowing who's used them and how you found it and what modifications you made will be really helpful for us. So we encourage you all to engage with us as partners in this process to improve these tools and make it a really strong contribution to this whole field of local early childhood system building. This was where we were going to take some questions, but since we're already over time, I do know that 2 people typed in questions, and we will get back to each of you individually. I apologize that I don't think we can take the time off everyone's calendar when we're already over here, but we did want to point out a few other resources. Actually, Steve, do you want to talk about the early childhood data and action stories from the field briefly?
Sure. Last year, CSSP, in collaboration with the National Institute for Children's Healthcare Quality, had an opportunity to visit 3 places which are not just collecting data, but using it really well. There's been so much conversation about getting data, but it's really only fun if you can use it. And we found some places that have done a really nice job of using it. Very different places, rural, urban, suburban, different parts of the country, different methods and ideas, but had a chance to do a profile of those three, and that's the document that Kaylin has noted. It's the second link over there. Kaylin, you do the other ones?
Sorry?
Are you going to do the Insight one also?
Sure, yeah. I was just typing an answer to someone's question. We are going to be sending the recording out in an email that comes out afterwards, so have no fear. You'll be able to look back at this and soon enough look at the tools as well. So the third link there is to thencit.org, so that's the National Collaborative on Infants and Toddlers. That's an initiative of the Pritzker Foundation, the Pritzker Children's Initiative, and CSSP is one of the partners in that. They have a really strong framework for results, which is similar to what we've been working through. It's different in some ways, and we know that can be confusing for people, but it's similarly very grounded in focusing on shared outcomes and what are meaningful indicators of those outcomes, and then looking at some of the ways that the system needs to work to make those outcomes more likely. So I encourage you to check that out, and if your community or state is part of the work with Pritzker, there may be opportunities to plug in with that work and to share some of the thinking from some of these tools that can help inform how you think about how well you're accomplishing the goals in that framework. We will send a follow-up email after this that will include a link to fill out a survey about this webinar. We do like surveys, we do like data, as you might have picked up. So we'd love to hear your thoughts about the webinar, and then if you do use the tools, once you've had a chance to digest them and put them into use, we want to hear about how that went as well. So I just want to end by thanking everyone. Thanks to everyone who was able to hang with us for this extra 7 minutes. Many, many thanks to Aditi and Malia and Steve and Petra for joining us and for sharing your feedback on or your experiences with these tools as they've been developed. And we look forward to hearing about how it goes out there in the world with these tools. Keep doing the good work you're doing and have a great rest of your day. Thanks, everybody.